Jai Hind and a humble swagatam to my channel Med Talks with Roshni. So today we are going to discuss about a very recent and important topic, that is what vaccine should be taken to enter in India. Whether you stay in India or abroad, staying up to date with your routine vaccinations is a must. Some vaccines are specifically recommended because of increased risk, for example, coronavirus vaccine against it, and especially when you are planning to travel abroad. आज के इस वीडियो में हम डिस्कस करेंगे वो मैंडेटरी वैक्सीन के बारे में जो इंडिया में प्रवेश करने पर लगते हैं। यानी कि कोई परदेसी अगर हमारे भारत में आना चाहे तो उसे ये लिस्ट ऑफ मेडिसिन्स लेना अनिवार्य है। सो टू डिस्कस विथ, दोबारा से क्वेश्चन रीड कर लेते हैं। What are the vaccine to be taken to enter in India as per the current norms recommended by CDC and WHO? तो जिन लोगों को CDC and WHO के बारे में पता नहीं है, मैं बता दूं, CDC is the Center for Disease Control and Prevention, जो कि एक गवर्नमेंट बेस्ड संस्था है हमारे इंडिया में और देश भर में, जिनका काम है कि वो हमारे देश में जितने भी प्रकार के डिजीज हो रहे हैं, जितने भी प्रकार की बीमारियां हैं, उन्हें कंट्रोल करना, प्रिवेंट करना, इन सब की रिस्पॉन्सिबिलिटी इनके ऊपर है। And the full form of WHO is World Health Organization. So let's start. Travelers to India. The first point is vaccination against coronavirus is mandatory for the travelers, those who are intending to come to India. So when was this coronavirus discovered? It is recorded that a patient with symptoms affected by this disease was medically ill on 1st of December. However, an early case of infection was most probably occurred on 17th of December 2019. So, एक पेशेंट था जो कि बीमार हुआ था स्टार्टिंग में 17th of November, उसे फीवर थी एंड स्लोली उसके सिम्टम्स बढ़ते गए, ही वॉज हॉस्पिटलाइज्ड एंड 1st of December को ये डायग्नोस हुआ कि उसके जो बीमारियों के जो लक्षण हैं उसका कारण है ये नोवेल कोरोना वायरस। द इनिशियल आउटब्रेक वाज इन वुहान, चाइना, जो कि सबको पता है। सो व्हाट इज दिस नोवेल कोरोना वायरस? ओके, सॉरी फॉर द स्पेलिंग मिस्टेक, इट्स कोरोना वायरस or COVID-19, a viral disease caused by the coronavirus. It belongs to the family of respiratory virus, यानी कि जितने भी हमारे lungs related disease हैं वो उनमें से एक वायरस का पार्ट है ये कोरोना वायरस। The most common signs and symptoms are fever, dry cough and fatigue, and two most important signs and symptoms are loss of taste, which is known as ageusia, and loss of smell, which is known as anosmia. The mode of transmission is through droplet infection, यानी कि छींकने से, खांसने से, जितने भी आपके माउथ से सलाइवा निकलते हैं, अगर उस पेशेंट को कोरोना है तो आप अगर उसके टच में आते हैं, उनके संपर्क में आते हैं, तो आपको ये रोग होने की संभावना है। So, to fight against this disease, the government of India has launched two types of vaccines, and it was launched in India on 16th of January 2021. So, for the people residing in India, it's a voluntary act to take the vaccine while it's not mandatory. And it is not recommended for people with severe allergic reactions. Whether you are an Indian or you are planning to come to India, if you are allergic to any kind of vaccines or if your body is very sensitive to any kind of medicines, your doctor will prescribe you not to take this vaccine. So for those people who are supposed to take the vaccine, who are eligible to take the vaccine, they are in two doses, for an individual. And once you take the first dose, the second dose will be after 28 days from the first dose. So the first was coronavirus, that is the coronavirus vaccine. Next is hepatitis A and typhoid vaccine. So the CDC, the Center for Disease Control and Prevention, recommends hepatitis A and typhoid vaccine for most travelers to India. So let's know about hepatitis A and typhoid and then discuss about the vaccines against it. So what is hepatitis A? I've written in short, so it's helpful. Hope it's helpful for you. So hepatitis A, it's a liver infection which is caused by an organism, hepatitis A virus. It is found in the patient's stool and urine. Patient के मूल और पेशाब में ये पाया जाता है, which is highly contagious, यानी कि बहुत ही संक्रामक रोग है. So, hepatitis A vaccine is a preventable vaccine. That is why travelers are supposed to take this vaccine to help themselves prevent from this vaccine. And always be careful to use clean hands before eating. Always be protective towards yourself, towards your health, wherever you're going outside. Next is the vaccine composition. It comes in two forms, killed vaccine and live attenuated vaccine. If you want to know more about these kinds of vaccine, you can log into my blog through Google. The description about it is given in the description below. So let's continue with hepatitis A vaccine. Has a duration of protection for the age up to 45 years. So that was all about hepatitis A vaccine. Next, jump on to typhoid. So what is typhoid? Typhoid is an intestinal infection and the causative organism is a bacteria. Hepatitis A was a virus while typhoid is caused by a bacteria which is known as Salmonella typhi, which is dangerous but curable, dangerous to such an extent that it may lead to fatal death if it is not treated. So it's written here, if not treated, may lead to fatal death. But if treated at the correct time or if you have been vaccinated against it, it is a plus point for your body to get healed or to be protected against that disease. So typhoid vaccine is recommended for routine immunization by Indian Academics of Pediatrics. So the vaccine composition of typhoid is whole cell inactivated typhoid or paratyphoid vaccine and live attenuated oral TY21A vaccine. So the duration of protection is 3 years. So the travelers coming to India, the first vaccine for you was corona vaccine, the second is hepatitis A, the third is typhoid vaccine. Now let's move on to the next vaccine. That is cholera vaccine. So what is cholera? It's an acute, rapidly dehydrating diarrheal infection. So if you are having a diarrhea, not a common diarrhea, if it's an in excess amount and your body gets dehydrated, you can see a patient being collapsed after a severe diarrheal attack. So the organism behind cholera is bacteria Vibrio cholerae. It's a global threat and fatal. आपको इंडिया के भी हिस्ट्री में अगर आप हेल्थ रिकॉर्ड में चेक करेंगे तो बहुत से लोग कॉलेरा की वजह से मर चुके हैं. इसीलिए हमारे भारत में कॉलेरा के प्रति बहुत ही सतर्कता बनाई जा रही है और चारों तरफ सफाई अभियान और साफ पानी पीने का आदेश, साफ पानी से यूज करने का आदेश दिया जाता है because cholera spreads through contaminated water. And let me tell you an interesting topic. The point is blood group O is associated with increased vulnerability to severe cholera. That is, जिन जिन लोगों के blood group O type में है उनको cholera होने के chances ज़्यादा हैं. Medically उन्हें कहा जाता है cholera gravis. So, what are the vaccine type? Vaccine type is just oral cholera vaccine, यानी कि आपको मुंह से दिया जाता है, and it's in the form of killed vaccine. So, when you go to a shop intending to take a cholera vaccine, you will find it in the names of Dukoral, Shankol, Morkvax, Vaxchora. The one and only important point to be kept in your head is avoid food 1 hour before and after the vaccine, or else you may have a sensitivity reaction, you may have vomiting or any other types of side effects may be occurred. So it's a precautionary method to avoid food 1 hour before and 1 hour after taking the vaccine. The next point is pregnant and lactating women and HIV infected individuals should be included for OCV. OCV is oral cholera vaccine. So those who are pregnant, those who are lactating mothers, those who are infected with HIV human immunovirus are also included in the list for taking OCV. Now, cholera vaccine is recommended for visitors to areas witnessing this active transmission. जहाँ जहाँ इंडिया में कॉलेरा के आतंक छाया हुआ है वहाँ पे अगर कोई भी जाना चाहे तो उन्हें कॉलेरा वैक्सीन लेना ज़रूरी है. So ये हो गया. Next we'll discuss about JE vaccine, that is Japanese Encephalitis vaccine, which fights against the disease Japanese Encephalitis. It is an important cause of viral encephalitis in Asia, and it is caused by a mosquito, which has a virus within itself, flavivirus, flavivirus, flavivirus. An estimated 50,000 cases occur annually, with most cases occurring in children below 10 years of age all over the world. So in India around 2000 cases occur annually. आप समझ रहे हैं ना, 2000 cases every year with around 500 deaths. And most cases of JE occur during monsoon and post-monsoon period. यानी कि बरसात और बरसात के बाद इसी वक्त होता है जब मच्छरों को ब्रीड करने के लिए प्लेसेस मिल जाते हैं. So you should avoid any clogging water areas to avoid the breeding of mosquitoes. And in India, JE is a part of routine immunization at 9 months of age and 16 to 18 months in the endemic districts. So let's see about the highly endemic states in India. They are Assam, Andhra Pradesh, Bihar, Goa, Karnataka, Manipur and West Bengal. Okay, my state is also included. Vaccine efficacy. WHO estimates the vaccine efficacy to be 95%. So people, those who are worried कि JE की वैक्सीन लूंगी तो क्या मैं प्रोटेक्टेड रहूंगी, WHO कहता है कि वो 95% तक हमारे बॉडी को काम करता है. Next is JE vaccine is advised for those staying in the country for more than 1 month or planning outdoor activities, especially in rural areas. For travelers, those who are intending to come to India, you're most welcome. But if you are planning to stay for 1 month or planning to go out for outdoor activities to any village areas, please do take the JE vaccine for your protection. Next is Rabies vaccine. Rabies is an acute, progressive encephalitis caused by an RNA virus, that is the ribonucleic acid virus of the family. The name of the family is Rhabdoviridae family and Lisa virus genus. Let me tell you, 99% of human infections occurs from the dogs. Rabies causes around 20,000 deaths every year in India. The transmission occurs by bite, leaks on mucous membrane or open wounds by organ transplantation or exposure to other potentially infectious material like CSF, that is the cerebrospinal fluid, or brain tissue. Let me tell you, 30% of rabies cases are paralytic. The safe side is 70% is still we have the chances that you won't be paralytic. The best option is to take the vaccine. So, as for the vaccine efficacy, all cell cultured based vaccines have almost equal efficacy, and the duration of protection, individuals with history of vaccine received more than 5 to 21 years before have shown good anamnestic response after booster vaccination. That is, a booster vaccination is a must. If you are on a rabies vaccine course, you are supposed to take the booster vaccination as the completion dose and do not miss the booster vaccination. Next, the contraindication. There are no such contraindications, including the pregnant, lactating, and the immunodeficiency patients. Travelers involved in outdoor activities are advised to take rabies vaccine. The last point is malaria. Chemoprophylaxis is the use of medicine to prevent a disease. So we'll discuss about the medicines what you are supposed to take as a preventive measure against malaria. When you are coming to India, wherever you go, you have to take these medicines, except for the places that is Jammu Kashmir, Himachal Pradesh, and Sikkim. So, the first medicine in the list is tablet doxycycline for those people who are above 8 years, जो लोग भी 8 साल से उम्र से बड़े हैं. Start 1 to 2 days before travel. One has to take it daily and continue for 4 weeks after the traveler leaves the area. So the dosage will be 2.2 milligram per kg. The maximum dose will be 100 mg per day. Or you can take tablet Atavacon Proguanil for children more than 5 kgs, starting from 1 to 2 days before travel. The child has to take it daily throughout the stay and for 7 days after leaving the area. Well, malarial medicine is not recommended for pregnant ladies and those with severe renal impairment. यानी कि किसी भी रोगी को जिन्हें किडनी की समस्या है और प्रेग्नेंट लेडीज को मलेरियल मेडिसिन लेना नहीं है. So the third medicine is tablet chloroquine, which is applicable for all age groups, weekly once, 5 mg per kg base. Start 1 to 2 weeks before travel and continue for 4 weeks after return from endemic area. So this was today's video. I hope you have learned something new from my video, and as a feed for the day, a very common question asked in MCQs for your exams. The point is, current antibiotic therapy is not a contraindication for vaccination. The meaning is, if you are on an antibiotic therapy due to any kind of illnesses, you are not contraindicated for any vaccination. Meaning, if you intend to take a vaccine during an antibiotic course of yours, you are allowed to take a vaccine, except for oral typhoid vaccine. You cannot take any antibody if you are taking an oral typhoid vaccine, or if you are on an antibiotic therapy, you are supposed to finish it up and then only you can take an oral typhoid vaccine. Antibiotics and oral typhoid vaccines do not go together. So this was for today's video. Hope you have liked my video, and I genuinely give a heartfelt thank you to all my viewers. Please do like and share, and I have more upcoming videos related to medical and health issues. And if you desire to go through my blog, please go ahead, give me your shares, give me your comments. It will be quite helpful for me. Thank you once again.